Hi, welcome back to Kanneattan. ഇന്ന് നമ്മുടെ കൂടെ നമ്മുടെ ഗസ്റ്റ് ആയിട്ട് ഞങ്ങളുടെ സ്വന്തം ചെയർമാൻ ദി ഐ ഫൗണ്ടേഷൻ ഗ്രൂപ്പ് ഓഫ് ഹോസ്പിറ്റൽസ് ഡോക്ടർ D.Ramamoorthi. വെൽക്കം ടു Kanneattan, ഡോക്ടർ.
Thank you.
Thank you so much for finding time in between your busy schedule here. So I wanted to ask you a couple of questions which I've come across from our viewers who's been continuously asking us. When we take cataract surgery, lasers in cataract surgery has made waves in the recent times. How does it benefit the new cataract surgery?
Laser basically acts an element of precision, accuracy, repeatability to the entire process of cataract surgery. Even if I have to make a small incision from this point to this point in my hand, even though I might have 30 years of experience, if it was done by laser, the accuracy would be much better. Similarly, when we are using the laser for cataract surgery, what we essentially do is to plan out our surgery, feed it on to the computer, that is the size of the incision, the way we want the lens to be bisected, the size of the opening of the lens that we need to make, and then the laser is fired on to the patient's eye to create a template. Patient is shifted to the operation theatre and the surgery is carried out along predetermined lines, which obviously is much beyond what a human hand is capable of. So whenever we combine modern intraocular lenses with this, accuracy of performance of the cataract surgery obviously translates to better outcomes. So laser has always been synonymous with perfection, and we are happy that that element has been brought into the commonest surgery that's performed in the human body, and that is of cataract surgery.
ഡോക്ടർ ഇവിടെ പറഞ്ഞ പോലെ നമ്മളിപ്പോൾ കാറ്ററാക്ട് സർജറീസ് യൂസിങ് ലേസർ ഇതാണ് ഇപ്പോഴത്തെ ലേറ്റസ്റ്റ് ആയിട്ടുള്ള അഡ്വാൻസ് ഇൻ കാറ്ററാക്ട് സർജറീസ്. So now we know that laser is the new thing for doing or getting a perfect cataract surgery done. But doctor, is it safe?
It's absolutely safe. It's very controlled, and we use extremely minimal power, minuscule amount of power for an extremely short duration. It's very controlled. So it's absolutely safe. It's beyond question, it's safe.
I understand the accuracy part where when you use laser technology for doing cataract surgery, it is more precise. But how does it come to the patient's advantage?
Obviously, as far as the patient's recovery time is concerned, the duration of surgery is concerned, and the accuracy of placement of the intraocular lenses. Basically, in cataract surgery, what we do is to remove the natural lens which becomes opaque and replace it with an artificial lens. If this artificial lens is placed extremely precisely at the center of the eye, with the entire cataract being removed with just the supports left behind in a pristine manner, obviously that would translate into better outcomes, and that's what laser helps us to achieve.
Anything which is new, anything which is higher end in technology is always accounted to be expensive. So we would like to know whether this high end top technology, would this come expensive to us?
That's true. It is expensive in the sense that the cost of the equipment itself comes to about 2.5 crores, and then there is significant amount of consumables that are used. But because of the numbers that we are able to do, we are able to generally make it available to all the quite a majority of patients. There is an order-on price of about 40,000 rupees per cataract surgery when we use the laser. But when you are doing it with precision intraocular lenses, where outcome is the most important consideration both for the patient as well as the physician, it obviously translates to something which is worthwhile.
I've also heard this about the other components in cataract surgery, that is we use the modern intraocular lenses. What are these newer lenses which are available in the market now?
Basically, what is being Navnita is asking me is about what is this intraocular lens. Basically, all of us have a lens which becomes opaque with age, and what we do in cataract surgery is to remove this lens in a very precise manner and replace it with a artificial lens which focuses the beam of light onto the retina. Previously, we were making a large incision and introducing the lens inside, but nowadays we have foldable intraocular lenses which goes in through a small 2mm incision and unfolds in the eye. Again, we want to improve the quality of vision in the patient's eye, and the best quality of vision each patient is supposed to have is at the age of 20. And when we do this cataract surgery, it's not removal of the opacity, but it's not a vision restorative surgery, but what we are aiming at today is a vision enhancement surgery. And by putting in aspheric intraocular lenses, we are able to give back even an 80-year-old the kind of vision he or she had at the age of 20, as far as the quality of vision is concerned. Secondly, there could be certain amount of power in the cornea, what's called a cylindrical power. The conventional intraocular lenses normally do not correct this. But nowadays we have available, and we are using to a large extent, almost 30% of our patients get what's called toric intraocular lenses, which corrects not only the spherical power but also the cylindrical power, because of which even patients with a significant amount of cylindrical power can see at a distance without the requirement for glasses. Then again, when we are beyond the age of 40, as most of us know, patients require progressive glasses for distance, near and intermediate distances. And when in conventional cataract surgery with normal intraocular lenses, patients have to wear glasses for reading. Today we have what's called multifocal intraocular lenses, which enables patients to look at all distances without the need for glasses. And the latest introduction is what's called a trifocal intraocular lenses. As we all understand today, intermediate distance, that is looking at laptops, at tablets, even picking up things from a display counter or looking at the dashboard of the car while driving, which is all at intermediate distance, has become important. So trifocal lenses essentially focuses at distance, intermediate and near. So almost we have an entire array of lenses with which we are able to give back the vision to the patient to function without the need for external optical crutches like glasses or at all distances, and completely be free of glasses.
Interesting. So you're telling me that a person who wears glasses getting the cataract surgery done does not require to wear glasses anymore after his or her cataract
Absolutely.
surgery. That's
It
beautiful.
is something amazing. There have been quite a few 70, 80-year-olds who have spent the last 60 years wearing glasses, but subsequent to their cataract surgery, they see a whole new world of vision without the need for glasses.
Thank you so much for your time, Doctor. So that was our chairman, Dr. D.Ramamoorthi, who has been the ex-president of the Ophthalmological Society, All India Ophthalmological Society. He was with us sharing his insights on the latest technology, or the latest that's in cataract surgery, the laser assisted cataract surgery. This has been a great experience for us because we got to interact with somebody who has got a wide experience of over 36 years of practicing, and who has led many to light. This interest, this excellence in keeping up with the latest in technology, the always being at the forefront, is what has taken Eye Foundation to where it is now. Starting with one branch, we stand with over 13 functional branches. We have at Bangalore, Cochin, 3 centers in Coimbatore, one at Metupalayam, one at Ooty, Pollachi and Tirupur. So the hard work, the efforts behind the whole thing from this one man, Dr. Ramamoorthi, the chairman, signing off from Kanneattan. Thank you so much. Until next time.